if there's one upside to the coronavirus, it's that we've all got to know Dr. Ranjeet Brar. Dr. Ranjeet, thank you very much for joining us. What can you tell us about the impact of the breakdown of lockdown? Because it has effectively now broken down. Pubs are open, restaurants are open. A friend of mine was on the London Underground coming to work this evening, and reports that virtually no one was even wearing a mask. It's as if it never happened. Is there any discernible impact of that on the figures?
George, pleasure to be back with you again. Thank you so much for having me. I think the situation on a world scale is truly scary at the moment, George. It's as you say, the virus has not gone away and it's got a long way to run. So in the world, we're seeing 14.5 million cases and 610,000 deaths. And perhaps we'll talk about the United States a bit later on, because there it's really running out of control. Here, it's quite clear that lockdown, as you say, has effectively ended. People are going to restaurants. Some people are wearing masks, some aren't. The rules are opaque. People are themselves confused. Even if you're in a hospital, the rules about processing of patients and wards and PPE change on a daily basis. So no one knows quite where they are. Certainly true that essentially there's a far greater degree of social intercourse, and the British government themselves are concerned, giving their mixed messages, wanting to get the economy sorted out. But of course, there's a global capitalist economic crisis which they're powerless to affect, really. But at the same time, concerned because they realise now overwhelmingly that there is going to be an increase here as well. I think Chris Whitty was quite clear when he said in September there will be a large increase in cases. He said it very openly. It's unavoidable, and we can expect a large increase in numbers September, October, November, and that's in line with the predictions we've been making based on the evidence that we've been seeing. But it's the most explicit recognition from the government that this is going to happen. They don't expect to have a vaccine ready in time. They're expecting to see a great increase in numbers. People can't be expected to make up their own individual rules. If they're pressured to go back to work, they will go back to work. Economically, they need to do all they can to try and secure their living. But of course, it puts the population at risk. And as we've said, the vast majority of the population haven't been exposed to the virus and remain vulnerable, George.
Now, on that point, let's deal with that point first. If Chris Whitty is right, is the National Health Service capable of dealing with that large increase that he didn't just predict, he stated as a certainty?
It's a very good question. So essentially, there's been the mantra from our government that their principal aim in the way that they've dealt with the crisis has been to stop the NHS from being overwhelmed. It's my contention that the NHS absolutely was overwhelmed. And it was overwhelmed, and that's reflected in the fact that all other elective services and a skeleton were closed down, and really only a skeleton emergency service was provided. That's in line with the expectations that if we were to meet a pandemic as modelled and tested on a national scale during an operation in 2015 called Operation Cygnus that we've discussed before, overseen by our previous health secretary, was essentially showed that the NHS would fall over, and did fall over. So I don't think that we do have the capacity to deal with a large increase, as we didn't really have the capacity to deal with it in the first place, other than by shutting down our already, vastly overstretched NHS. We've seen that there are now 10 million people waiting for appointments and procedures in the NHS. Is an unprecedented number. And that really is an indication that the NHS has failed to cope. It's failed to cope because of a deliberate process of running down capacity with a view to forcing people into private insurance and advancing the agenda of privatisation of the National Health Service, George.
Well, I'm one of those in that sense. My wife is going to give birth any day, any hour, any day. And we are doing it at home, a home birth, something I thought passed into history when I was myself a small child. I myself would never have considered that. But if it was the choice of having a home birth or going into a potentially deadly hospital, overwhelmed by coronavirus, it was a no-brainer in the end. And there are many people we know have died, cancer patients, for example, who have not been going into hospital because the hospitals have been overwhelmed. I'm just wondering if September is as bad as Whitty thinks it is, we'll be back to where we were back at the very highest point of this crisis.
I think that's right. I mean, home births, of course, have become very fashionable. And for those who are very well and are lucky to have a midwife in attendance, then it can be a good environment in which to have a baby. It's not my first choice, I think, because precisely because childbirth is so high risk. But at the present time, the balance of risk is changed, I think, with coronavirus. And everyone is doing everything they can to avoid attending hospital unless absolutely necessary. And that's understandable to a degree, but it's also an indictment of the way that we have organised the health service during this. We learned that the government are basically in talks to continue to buy up all of the unused capacity in private health service. So they must be paying billions for that. And we've seen that this week, revelations about billions of other contracts to firms who are unable to supply goods and services, but billions nevertheless having been passed to them, all in secret, all without scrutiny, all under this current legislation pushed through on the back of the coronavirus pandemic. And we're seeing that increasingly. So it's reasonable for people to try and avoid hospital. But the fact that rather than use other centres, so we really needed from the very beginning to have centres separate from the main NHS that were dealing with the coronavirus pandemic. And that would have been the sensible way to approach things, rather than funnel the coronavirus into hospitals where there are vulnerable people, funnel people from hospitals into the private care system where there are even more vulnerable people, not protecting the general population, not putting testing, tracking and tracing, and social isolation facilities at the forefront has been our failing from the beginning. And all of that has been conditioned upon the way in which our NHS has been organised and the pressure it's under constantly to rationalise, downsize, make cuts year on year with a view to soften it up for privatisation. And that's been our tremendous failing. And I fear that that will put us in a very serious situation as we approach the winter, George.
Now, you mentioned the United States. I said last week that if Florida was an independent country, it would be one of the most afflicted countries on the earth. Tens of thousands of cases a day, and that has not improved in the last 7 days. Rather, other states like Texas, like Arizona, like California, have gotten very much worse. Why is it so out of control in the United States?
I think that's right, George. Florida has had 12,000 cases in a single day, and Florida has had 350,000 cases. So Florida has had as many cases of coronavirus as the UK, test-proven cases. And the United States on Thursday had its worst ever day, where it posted 77,000 cases in a single day. So essentially had the number of cases in a single day that China has had throughout the whole pandemic. And we've talked about, again, the reasons that underlie the US response. But now it's become at a certain level within the community, without there being an ability to stop it spreading in the major centers of population, where it is in an exponential growth phase, where the R number is very high. It's predicted to be around the 3 mark. And that really means that, one person is passing on to 3, is passing it on to 9, 27, and so on. So it's really a huge rate of increase. And it's very difficult at that stage to stop the disease from spreading. We know from the beginning why they haven't been able to get on top of it, and that's been conditioned by both the political system, the Trump administration, the poor political briefings, overwhelmingly the private medicine and the lack of access to medicine. And we've said it again and again, but it's worth repeating that the richest 3 people in the United States have the same amount of money, wealth, power as the poorest 200 million. And that's an incredible statistic. So it means that there's a vast underclass in the United States who really don't have access to the kind of first world facilities that you would expect to be present. And that's precisely, again, because of their insurance-based system. And that's the system, of course, we're driving towards in this country. Very recently, last week, they announced the closure of Epsom and St Helier Hospital, for example. So there's a constant pressure to downgrade our NHS structure, huge numbers of contracts being given out to the private service, and everything is being pushed in the direction of us following in the footsteps of the United States. And particularly at this time, you couldn't really think of a worse way for us to go in our healthcare provision. And of course, amidst all of that, the levels of aggression, the rhetoric against China is really stepping up, almost onto a war footing. And we know that Huawei, you've just been talking about, the contract has been cancelled, but really there's a trade war, a global economic war, a war for the minds of people that is going on and underlying this crisis. So while the United States is unable to look after its people, it's constantly pointing the finger of accusation, in particular at China as being its largest global competitor, the new workshop of the world. And it's desperate to sanction other governments, including the UK government, to stop us from doing trade deals. And it was disappointing, perhaps not unexpected, to see Lisa Nandy, even the Labour Party Shadow Foreign Secretary, actually embarking on that war rhetoric and trying to out-Trump Trump, to outdo Boris Johnson, and accuse the government of not being hard enough. That the solution to all of this, somehow, is to be extremely draconian in our relations with China. And once we step onto that diplomatic footing, it's preparing the ground for, trade war, and trade war is the prelude to war. And we definitely want to avoid that course with a nation like China. It's not in the interest of the British working people, and it's certainly not going to help us cope with the corona pandemic, George.
Well, when you said even, Lisa Nandy, I immediately thought that never was the word even more otiose than in the case that you cited. I'll be talking about China on Tuesday night at 8 o'clock online on all internet platforms. And I'll be expanding on some of the points that you have just made there. Dr. Ranjeet Brar, thank you very much indeed for joining us on the Mother of All talk shows.